earlier on we did tell you that the world today marks the World Cancer Day. It is marked globally on the 4th of February every year. And of course, earlier on we did reel out some terrifying statistics about cancer in Nigeria.
700,000 Nigerians.
Honestly. And let's bring in Dr. Omonisi Emmanuel, who is the National Treasurer of the Nigerian Cancer Society, at least to help us understand why we're seeing this stats. Thank you, Doctor, for being here. Looking at the data, 70,000 Nigerians, according to reports, died last year alone from cancer-related illnesses. And just a few days into 2023, about 124,000 cases have been reported across the country. Why are we seeing this astronomical rise in cancer cases in Nigeria? Yeah. What is responsible?
Well, there are several factors that are responsible. Number one is that most of our cases present so late. Despite the awareness, it will surprise you that people live in rural areas. Many of them are still cut off. From the mainstream. People still believe in traditional healing. Faith-based. Then you see patients, with early cancer, going to churches and other places, and by the time they come back to the hospital, present advanced cases.
The case would have
gone for advanced cases.
Worse, yeah.
Then the other issue is the issue of now have more, equipment actually that pick up many of some of those cases. So if you screen, there are all manner of screening going on actively in the geopolitical zone in the country. So if you screen, most likely you pick cases. You pick cases, and if you sustain that effort over a long time, the case start to decline. So you have mass screening, going on in the country. So the awareness is there, screening is going on, and also you have people presenting in the hospital. But the sad thing about it is that we see patients with advanced cases of cancer, in most of our facilities.
Yes, sad as it is, there's not been one study that has pinpointed that this is the cause of it and the rest, but you doctors keep telling us lifestyle, don't do this, don't do that. Is it an urbanized disease? I mean, when I say urbanized, the preponderance of it as compared to our rural folks who are close to nature, who eat natural foods, away from, those of us who with a call.
We see a lot of processed food.
Processed food.
Yeah, it's part of it, but actually the cause of cancer actually multifactorial. We have the genetic, factors responsible for cancer. Some people, they have the gene, their family, run their family. The one you've mentioned are the environmental factors, like sedentary lifestyle, people take alcohol, infection. Particularly in Africa, infection is the very significant cause of cancer. Matter of fact, about 23%, of entire cancer burden in Africa is due to infection. Infection like HIV/AIDS, hepatitis B viruses, human papilloma virus
will now trigger cancerous disease.
Doctor, let's look at the theme for this year: close the care gap, uniting our voices and taking action. Care gap, keyword there. Here in Nigeria, from research that we found out, we have less than 70 consultant radiation and clinical oncologists dealing with the over 700,000 people who are currently battling with cancer in Nigeria. We do know that, yes, there's a medical brain drain. We're seeing that in every other sector, but oncology, how much of the challenge? This is huge. Since we're seeing more cases, yet we don't have those who have the expertise to care for them. How can we correct this today?
In fact, talking about cancer care, you start from the data. Do we really know the actual burden of cancer in this country? Yes, we have cancer registry, population based in different geopolitical zones. But many of those cancer registry are not funded by government. Surprised they are not funded, So we need to strengthen our cancer registration system. Because that gap is there. That gap is there. So we need to get our data very accurate, It's not surprising that there's people rolling out figures, conflicting figures. Because the system of cancer care that is, responsible for accurate registration are not being supported in this country. So that gap is there, Then the other gap is what we have discussed about diagnosis, Cancer treatment is not for, diagnosis is not for, what people outside that field will diagnose. Radiologists and pathology are central, diagnosis of cancer.
I was
how many radiology, how many pathology we have in the country?
So that's a huge problem.
That's a huge problem.
And now we're looking at this level of medicine. It's tertiary.
Yeah.
It's not primary.
Yeah.
And the inadequacies are so wide.
In fact, that is diagnosis. Talking about management now in terms of surgery. How many surgeons do we have in this country? People are migrating. We have the bed drain eating the country. Then of course the oncologists. How many do we have in the country?
That's why I asked you
the gap is there.
I asked you the question about how we get. Because even the WHO now is projecting that Africa will account for 50% of childhood cancer burden by 2050, and Nigeria is projected to be at least more than half of that figure. So how do we address it today? So go back to the question I asked you. The data is there, even if sometimes you question some of the data, but the WHO has actually reeled out this data. How do we get it right today to reverse the trend?
Well, we must say that all hope is not lost in this country, because the fragment have actually did some intervention which we think, to help reversing the trend. You recall that a few years ago, Cancer Aid Fund was actually, created by federal government to help the indigent patients. Because cancer treatment is not, something that to cost a patient a few thousands. Some people have to sell their vehicle, they are building their estate to get it done. The cost of chemotherapy is not a joke. Some people, their salary cannot cope. Radiotherapy, if available.
And where is the NHS in all of this?
Of course,
where is the NHS? Where is the National Health Insurance?
I doubt it even covers cancer.
Yeah, no.
Recently, your NHS does not even cover, the simplest of MRI.
No, I think recently the federal government has actually, agreed to, cover, include cancer as part of, those diseases that should be covered. That is there. So efforts have been going on, all over the country. Like I think a few months ago, some teaching hospital in the CGO political zone were actually upgraded. You now have radiotherapy,
centers.
Those are efforts to actually close the gap. But the major issue is the issue of human resource. Particularly the issue of brain drain. Is a major problem. Because you have the equipment, you have the machines. Who's going to run those equipment? We're going to make diagnosis. The surgeons and pathology, radiologists, oncology, are living in drones.
Right.
What happened to the system?
But with cancer, they will always say early detection always save lives. People should go get checked, because once you catch it early enough, the rate of survival is higher.
Yeah.
We have to say thank you so much, Dr. Omonisi Emmanuel Bamidele, the National Treasurer, Nigerian Cancer Society. Thank you so much for joining us.
Thank you for coming.
On the program.